considerable credibility.
Well, John Barrasso, the senator from Wyoming, he's a doctor too, with new criticism of Kathleen Sebelius and not holding back, and here is part of the reason why. From late on Saturday.
Our website still isn't loading properly. We're probably just overloaded with traffic. Millions of Americans are visiting healthcare.gov, which is great news. Unfortunately, the site was only designed to handle 6 users at a time. So if you're in a rush, consider using our low-res website with simpler fonts and graphics.
That's the old dial-up system where you log on, punch the number in, walk away for 15 minutes and come back. Karl, how you doing? Karl Rove is the former senior advisor, deputy chief of staff to President George W. Bush, and a Fox News contributor, and good morning to you. You have dealt with crisis in your role at the White House for 8 years. How does Kathleen Sebelius either defend her or this program this week?
Well, it's going to be awfully hard. I think her best defense is to try and keep the focus on we're going to get this problem solved. But look, this morning the Wall Street Journal had a piece. There was actually 3 groups of people. There are people at the Office of Consumer Information and Insurance Oversight, a new office at HHS, planning the website. There were people at the Center for Medicaid and Medicare Services, CMS, 40 miles away in Baltimore. They were planning the website. And then we had White House officials who were delaying important decisions that had, the implementation of rules that had real consequences for how you designed the website and what it could do. So we had nobody in charge. No one single person said, I'm in charge of this. Everybody has to agree to the same deadlines, and we're going to execute. And at the end of the day, somebody has to be held responsible for that. And the secretary who's in charge of this implementation is that person.
Well, what's she going to say? Give us some more time? Hey, we've had some screw-ups, but we're working on this, and everything in the end will be fine. Can she even come close to saying that?
Well, she's going to say it, but whether or not she's credible, look, when you become a parody on Saturday Night Live, it's awful hard to recover. But the even more devastating than that is what the American people think that they have heard about this website and what they've heard about this rollout and this implementation, and none of it is good. And again, nobody appears that they're in charge. And the White House is not taking responsibility. They're saying, go talk to HHS. This is all over at the Department of Health and Human Services. And inside the HHS, got the people at the Center for Medicare and Medicaid Services saying, well, you go talk to the HHS people, and they're saying go talk to the CMS people. This is still today a very ragged operation. Now, they do have one guy who's now in charge, and he says it's going to get done by November 30th. But as you saw as you heard in your earlier segments, there's not a lot of confidence in the industry, whether it's the high-tech industry or the health insurance industry, that thinks that's